Over the last decade, the rate of transmission of HIV has dropped significantly here in San Diego County and many other parts of the country. But an LGBT clinic in Hillcrest, responsible for much of that free testing, will close their doors later this month. CBS 8's Evan Narani talked to the co-director about why the closure is bittersweet.
When this health clinic in Hillcrest opened their doors in 2007, their goal was simple but daunting: to get to zero transmissions of HIV infections in San Diego County. Dr. Susan Little is a professor and co-director of UC San Diego's Antiviral Research Center.
People who are newly HIV infected, who just acquire infection, are the most infectious. And those are the people who often don't know that they're infected and are the most likely to transmit to other people. And so we were interested in helping to identify those people, link them into care, and learn who those people were in San Diego so we could provide them care.
The clinic Good to Go originally opened under the name Lead the Way as a campaign based out of UC San Diego and funded by the National Institute of Health to identify people during the earliest stages of HIV infection. Over the years, that expanded to more comprehensive STD screenings and access to medication meant to reduce the risk of spread, all completely for free.
This is a free service that if you qualify for the service, you don't have to pay anything.
But after 15 years of providing those resources to members of the LGBT community, Good to Go will close their doors later this month.
Part of the reason that we're closing is that the number of new infections in San Diego has finally dropped to such a low level that we no longer need a program like Good to Go.
Dr. Little says they're down to a fraction of positive HIV cases in San Diego County compared to 2009. Back then, more than 1,000 new positive cases were being identified each year. 10 years later, in 2019, that number was more than cut in half, with fewer than 400 annual cases and even fewer today.
I think HIV is not gone. We still need help ending the epidemic. That's really the priority right now. And people who are living with HIV, who need to stay engaged in care, are really now the priority, as well as people who are at risk for acquiring HIV.
The team in charge of this campaign tells us this story is bittersweet. After all, they cut the HIV transmissions in our county to a fraction of what they were a decade ago, but many who have come to Good to Go for years will now need to find a new place to get tested as they close their doors.
It is a great thing for that reason, but unfortunately with that comes the closure of services like this that are essential for the community.
In their 15 years while open, Good to Go conducted more than 42,000 HIV screenings and connected hundreds of participants with medication that can reduce the risk of HIV contraction.
It is incredibly effective, 96, 97% effective when taken appropriately. We want people to become more aware of it because we want people to feel comfortable living the lives they want to lead, and that can be done with pre-exposure prophylaxis.
They also connected HIV positive participants with medication that can reduce their viral load to the point where it's undetectable and therefore untransmittable.
What I want to do is make sure that the people who've been coming to us for years, who trust us, are transitioned as smoothly as possible into another situation that works best for them.
The final day for eligible members of the LGBT community to get a total test will be March 17th. In Hillcrest, Evan Narani, CBS 8.
But as one door closes, another opens. The San Diego LGBT Community Center announced that they will provide free STD screening services to the local community moving forward. For more information on booking an appointment, just go to our website and click on the Help button.